So, good afternoon, everyone. My name is Ingrid Palacios, and I'm the Multicultural Outreach Program Manager for New England Donor Services, the oldest organ procurement organization in the U.S. Today, I have the honor to have an extraordinary cohort of specialists and experts in our field that are going to be joining me in this very important conversation about improving donation authorization rates within the U.S. Muslim communities. A 2017 study estimated that 3.45 million Muslims were living in the United States, about 1.1% of the US total population. These communities are as diverse culturally as they are racially and ethnically. However, a common thread which runs through the entire population of Muslims in America is the hesitancy to authorize organ donation for a loved one. Recent research has shown that there exists a persistent lack of understanding regarding donation and the process for transplantation among Muslim communities. Lack of trust of the medical community also contributes to this hesitancy. Unfortunately, among many Muslims in America, the popular notion is that organ donation is not permissible in Islam. So, for the sake of time, all the short bios of our speakers, you can find them in the website of Profound Conversations. And I want to kick off this conversation asking Dr. Bagby to enlighten us, to join this conversation by starting us with an understanding of the Muslim faith, the Islam religion, and some of the fundamentals that we need to know to start understanding this community.
Okay, thank you very much, Ingrid, and thank you for inviting me to this very important conversation. The Muslim community has been around a long time, for one. At least 10% of enslaved Africans who were brought to these shores were Muslim, at least. And so there's a long history of Islam in America. The large numbers of Muslims did not start until the 60s. And as you said, now we're close to 4 million Muslims in America. And the Muslims are spread out all over the country. The biggest population right now is the South, growing in areas like Atlanta and Dallas and Houston. But Muslims are everywhere, and in fact, in actually small towns also, where Muslim doctors were forced at least one time to practice in underserved areas, and Muslims created communities there. So Muslims are all over, a very diverse community. From Africans to South Asians to Arabs, Central Asians, Turks. It's an unbelievable, very diverse community. And it is a community that is well integrated in America. Many scholars comment on how well the American Muslim community has fit into America as opposed to the European Muslim community, which still is somewhat isolated. So the American, in fact, Pew in their 2017 study uh, reported that 89%, so about 90% of Muslims said that they were proud to be Muslim and proud to be Americans. So the issue of, fitting in, of, trying to be a part of America maybe was an issue decades ago, but is not an issue now. So the Muslim community is well situated, well educated, and religious. So over 2/3 of the American Muslim community reported in the last Pew study that religion is very important for them. And that goes across the board. Uh, Young adults, middle age, elderly, all of them have around the same percentage. So this is a religious community. And also, I must say that, in my own studies, it is a community that is open to being flexible, what I call being contextual in terms of understanding how to apply Islam in their present circumstances. So it's not a very, what can I say, super traditional community. It is open, right? And of course, the dilemma is that the classical Islamic understanding is that you do not mutilate, you do not cut up a body after death. And actually, the reference, and it's not a very strong reference, in other words, it's not in the Quran, the holy book. It is not specifically cited in any of the sayings of Muhammad, may God's peace and blessings be upon him. It's actually based on the command that in the battles that took place, Muslims were not to mutilate the enemies that were killed, which was the practice of others to do that, to mutilate their enemy, upon death, cut off their ears or whatever. And so Muhammad said, no, you don't do that because there's a sacredness in the body, even in death, right? And there's an understanding that the body is, when even upon death, there is a sense of consciousness that still resides in the body. So based on that, autopsies in the modern times have been prohibited. And in the beginning, organ donations were also prohibited. So this idea of cutting up the body, mutilating the body, is something that's not only religious, but is very cultural. I must say, it is deep in the culture of people across the board. In other words, this sense that this dead body is somehow has to be honored is deep in the culture across the board throughout the Muslim world. And so, this is the obstacle that is to be faced. But I must say that there are fatwas. Fatwa is a legal ruling by an individual or a body of scholars that offer an opinion on an issue. So there are many fatwas, Islamic opinions of scholars throughout the Muslim world, and including one of the main scholarly bodies, the Fiqh Council of North America, that have allowed organ donation. So, in terms of scholarly work, in terms of scholarly opinion, there is not really an issue. But how many Muslims understand that, or how many Muslims are influenced by it? That's the big question.
That's the key
I'll
piece
stop
of this whole conversation. I appreciate you really starting us to understand that, because the work that we do is important for us to know not only the mentality or the mindset of the Muslim community in the US, but then culturally and historically, how that comes about. For us as professionals in this donation community to really be sensitive and knowledgeable when we are approaching families, when we're working in the community or at the hospitals or creating initiatives to advance. And in this point, I would like to ask everyone that want to give your opinion about this piece, but specifically Dr. Callender, who has been a pioneer with this work in organ donation and transplantation when it comes to working with multicultural communities and founding the MOTEP in 1991. What initiatives specific related with Muslims, Dr. Callender and Dr. Purnell, because I know you're also part of the board of the MOTEP, are being done right now in the national level to kind of work their way through on this um, very sensitive topic that it seems to have different angles and different perspectives. And so I wanted to hear your perspectives.
Yeah, I've been blessed and able to work with Kareem Ali for a couple of years now, recognizing that there's no real reason why the Muslim community cannot participate in organ tissue transplantation and donation, and that fatwas have been released that identify the fact that saving one's life is a great tradition and a great honor. And if one has the opportunity to do this, it is the right thing to do. And so it has been my impression that the real work that we have to do is to get the communities long before they get to the hospital to recognize and understand that it's okay. It's the right thing to do, and that there is no religious obstruction to becoming a donor because you can then save one's life and somebody else's life, and that's a great religious tradition in most religions, and especially the Muslim community. And so, my impression is that we need to do as much as we can to educate all communities, and in particular the Muslim community, long before they get to the hospital, so that public education in schools, in elementary schools, and in middle schools, and high schools, and colleges, and wherever you find people, to recognize that we are really talking about uh, being being humane and doing the right and honorable thing to do for our fellow human beings. And that is something that is true for almost all religions, and the Muslim religion is no exception. It honors and recognizes and wants all to do the right thing, and that is to love one another and to do what we can to preserve life and to uh, let it last as long as possible. And when there is an opportunity to be helpful and donate, so that there's no reason why we can't uh, educate and empower our communities of all religions, and especially the Muslim community, that it is the right and proper thing to do to help another human person and give them a second chance at life when it's possible.
Absolutely. Dr. Purnell, I don't know if you would like to add to that.
Of course, I would like to first echo everything that Dr. Callender just said. And I apologize for the sirens in the background in my office here in East Baltimore. But perhaps a potential donor, who knows, right? Because unfortunately, we live in a neighborhood where we know that there are pretty high death rates, especially among younger populations. And sort of echoing and building upon what Dr. Callender said, I am excited to see that we collectively have now recognized the importance of breaking down these silos, breaking down this false narrative that there's an us versus them, that all of these different philosophies allow us to cross pollinate ideas and to share mechanisms that we know to be helpful in engaging community members. When we really interact with each other, what we often find, right, is that we all want many of the same things. We want our loved ones to be healthy and happy. We want our communities to be safe. We want to be able to help each other. We want to adhere to our principles and our values and our moral systems. And I think that the more that we can do collectively, right, to continue to push the true narrative, which is that we have more in common than we have differences when it comes to wanting to help each other and humanity as a whole. I think that that's where we really will see progress at a broader level when we really think about, removing the silos and sort of along those lines, some of the things that we know are ongoing right now. For example, National MOTEP, in collaboration with the National Kidney Foundation, will be sponsoring a webinar that will collectively highlight multiple leaders, including people like Kareem and Sharif, and thinking about, okay, what are some of the barriers, right, to things like living donation? What are some of the shared lessons across the board? And our hope engaging not just those of us who what we say in the Baptist church, preaching to the choir, not just those of us who've already sort of bought into this narrative, but also bringing in others who may still not understand that in many ways we've made a lot of progress in moving beyond a lot of these stereotypes. But we may have, for example, some small community practice nephrologists, or some surgeons or others who may still be holding on to old data, or who may not realize that there have been many initiatives like this profound conversation where the community is primed and wants to know more about the steps that are needed. So I think as we continue to engage each other and continue to share best practices across the board, again, we'll find that we're able to break down these silos and really make real progress.
100%. I can't, everything that you were saying, I'm like, I'm so excited with you. It resonates with me because as professionals in this field, we haven't really talked about these silos as profoundly as we need to. In like really recognizing the cultural aspects, the ethical aspects, the historical aspects in order for us to be better prepared, to be no more compassionate, but be more culturally intelligent, culturally sensitive, and work with our donor families, work with our communities, our Muslim communities, our physicians, because the work that we do is all collaboration. So as we go through this conversation and we are identifying more and more barriers and challenges and also best practices and how we are collaborating in this partnership in this type of initiatives, I would like to hear from Chaplain Tahara Akmal and Dr. Zainab a little bit more to help us continue identifying barriers, biases, and how to overcome that. And one of the questions that come to mind also is regarding brain death. Um, how the Muslim religion, what's the position on regards of brain death? Because I think that's a good start point for us to understand also that as a potential challenge or barrier, and talk a little bit more and understand more about the position of the families, the position of you as professionals working with families or teaching about these pieces. Please, the floor is yours.
Yes, thank you so much again for being invited to, speak about this very sensitive and very important topic. From 2010 to 2011, I was doing my second year of chaplain residency at Johns Hopkins, and at that time, I was in a residency program where we were providing support for families making decisions about organ donation. We were working alongside with Donate Life Maryland, and we were there to support the family and to also support staff. What I see that has been a barrier, if I fast forward today, part of the role of the chaplain is to provide, the words you all are using, to provide compassion and comfort and to listen to what the family's needs are, their cultural needs, their spiritual needs, their fears. Do they trust or distrust the medical team? So there's a lot of factors that are involved that a chaplain can learn about through this connection with the family. So one of the things I learned during my year of residency with families making these sensitive decisions. Their approach to organ donation, brain death, how they viewed it from their Islamic perspective was very diverse. We would have families coming through Johns Hopkins International, and a lot of those were Muslim families coming to Baltimore for a sense of cure or healing. And when it didn't go well, they had to make these decisions. So depending on where they came from, their culture, their country, some would say yes to donation and some would not. And it was very diverse in their reasons why. So I think one of the things that is very important is to get organizations like the Association of Muslim Chaplains involved, because we are a smaller group of chaplains, but we have the ability to come alongside of the medical team and the organ procurement agencies to have these conversations with the families to break down communication barriers. Because some of the things that Muslims would tell me is, and Dr. Bagby addressed it, is this okay Islamically? Is brain death really death? Because they understand death to be cessation of breath and the heart stopping. So what is brain death? I'm touching my loved one and they're warm and they twitch every now and then. Really, are they really deceased? So there was a lot of confusion, a lot of questions that needed to be answered. So one of the roles that I had as the chaplain was to listen to the concerns and to be this intermediate, like an intermediary between the doctors, the staff, and try to help them have these really sensitive conversations. Although we never approached them for organ donation, once they did approach, we would come alongside to support. So your question around brain death, and I would refer to Dr. Bagby to say more about that. I'm not scholarly enough to say exactly what the ruling is. I know there's been different views about it, but what the families believe is really important. And I think that's something that we as chaplains, Muslim chaplains, and in the Muslim chaplain community is growing in leaps and bounds due to some Islamic seminaries that have come up over the years. So I think we could be a rich resource for the families and the organizations and hospitals. And I wonder if my colleague, Dr. Zeinab, would like to add her comments.
Yeah. Thank you, Tara, that you mentioned the important things from the point of view of chaplaincy. Just I look at the documents and some literature about the factors that might influence attitude toward the organ donation. Just I found a religious interpretation, culture beliefs, lack of awareness, mistrust of healthcare system is the things that I want to focus on it more, and family opposition, fear of premature death and misconception. The things that I found from the literature was more about mistrust of healthcare system. It's the things that we as a chaplain, we have to focus more about that. Why Muslim patients, maybe they don't trust to healthcare system to donate their part of the lower body to others. And the other thing that I want to add is that the factors that contribute to variation in the organ donation rate among the Muslim countries, I found something about legal and legality framework, culture norms, healthcare, infrastructure, public awareness, and education. The things that make me to thought about more, it's about the public awareness and education. Maybe we can work on it more, and some economic factors or governmental support. For us as a chaplain, the things that I'm focusing more on it for this topic is about the feeling of the patient, as the Tahara mentioned it, and the the family, that we can support family more during the time that they are in the hospital, to have their trust and let them to be more aware about the second step after that.
Well, I was just going to add something to the question of the definition of death and whether it includes people who are brain dead, because this is still a contested issue among Muslims. So Muslims are all over the place as to how to define death. There are some that say brain death should be, the definition. Others say no, it's when the heart stops. And even the Fiqh Council of North America did not want to weigh into it at this time. So they basically punted it. And so there's still a lot of work. But I must say, kind of as a footnote, almost all the scholars agree, though, if a person cannot breathe on their own, cannot live without machines, then it is a choice of the caregiver whether they can take them off the machine. So there is that kind of understanding that if the person cannot really live without a machine, then it's okay to make some decisions about that. We need help on this issue of
Yes, and we
what
need your
constitutes
help
death.
also in this. I'm very excited to see two women Muslim chaplains that work at the hospital setting and also are professors and are, because you guys are a gift. You're so unique. We all have to agree that without the faith leaders and the Muslim leaders, sometimes it could be very challenging for us to even have the conversation about organ donation with donor families. And then that note, I wanted to include Shawn Paul in this conversation and walk us a little bit in your 19 years of experience working at the hospital level, not only with physicians, but with families of all walks and backgrounds. What are the biggest challenges, Sean Paul, that you have or your teams have encountered, and when working with Muslim families? Do you have any specific experience that you wanted to share with us that was specifically challenging? And then how did you or your team overcame that to make donation happen?
Well, thank you. So actually, that's kind of where I was going to pivot to when I had the opportunity, was just to kind of speak from some of the experience that we have. Because first of all, like, sharing a space with these families that have lost a loved one is very sacred. It's very special for us to have that opportunity to support them. Um, this overwhelming theme of trust. It's such a small word, but it means so much. And I think I'm going to take accountability for us in a way in saying that, is if, as far as for challenges and obstacles, us not being those challenges and obstacles, and having those preconceived notions, maybe from a lack of experience or lack of knowledge for these Muslim families, but making sure that working with the physicians and the hospital staff, that these families are being cared for, that we're not speeding up the process for making a decision about withdrawal of care or donation. Really, and I know that I was working with Kareem recently on a young man that had passed away in a family that was really struggling to make a decision. And it was really about working with the staff to take the time to meet the family where they're at and their concerns, and some of the things that maybe they didn't understand, whether it was brain death, or how non-survivable this injury was, and making sure that we could take care of them each step of the way. So I think for us, it's really just making sure that we're pausing in between, making sure that we're huddling with the staff and seeing where the family's at, so that we can determine, like, where do we need to go from there. And honestly, I had reached out to Kareem, and he gave us some guidance, to work with that family a little bit more. The outcome wasn't necessarily what we wanted for the family, but making sure that we could respect them along the way.
Absolutely. And on that note, I wanted to ask everyone, and Sean Paul too, are there any specific or special considerations that we must have when working with Muslim families? So I have worked as a family services coordinator for several years, and I will never forget one case that I was involved with a Muslim family that I ended up presenting on it as a case study because it was my first time seeing so many key players coming along. I was just starting my career in organ donation. So it was my first time meeting an imam. It was my first time having challenges to find an interpreter for this particular family. It was a very tragic death. The legal next of kin was the wife, a very young wife. They were recently married. She didn't know that this particular patient then became a donor, was a registered donor. And after overcoming all this, you can imagine the misunderstanding, not even lack of understanding, lack of knowledge of the whole healthcare system, the declaration of death, the declaration of brain death, including the community leaders and members, and then getting into, of course, opposition from the family. And I say, of course, because she didn't even know, she didn't even understand what that even meant, that he was a registered organ donor, because he has been living here in the United States for several years. Um, we got to, with the help of the imam and the help of the community leaders, to the request and the understanding that there were different and special rituals that that family wanted to observe, and that's why they were declining or being opposed to organ donation. When we were able to meet them, like Sean Paul mentioned, meeting the family where they were at and understanding those culturally aspects, and even we had a special request on how to even position the body in the OR for the recovery, after the recovery, and how a ritual needed to occur right after in certain amount of time that prevent us from us recovering corneas, for instance. Once we were able to, this has been always been, organ donation has always been a family driven process. So once we were able to honor all of that, we were able to move forward with donation. And it became one case that I will never forget. And I had been since so hungry of learn all this information to be able to encounter these type of cases with respect, with knowledge, with openness. So in your experience, Sean Paul, and then the scholars and the experts in our cohort today, are there any special considerations, any special rituals, anything that you would recommend for us to keep in mind when it comes to organ donation and transplantation and then working with the Muslim families?
I'll go back to it's more for us as the OPO staff and the hospitals, and understanding that every family grieves differently, regardless if it's a Muslim family or whoever it is, because sometimes it makes, and I'll say us just as in general, but it makes us uncomfortable. And so that's what I mean by not getting in our way of understanding and loving this family that's going through things. And if there are special rituals and things that they need, that making sure that we can continue to work through those things. For us personally, I know that, we need to increase our resources. That was one of the reasons why I had reached out to Kareem, was for an imam and having an interpreter that could bridge that gap. So those are some of the things that we're experiencing here.
I wanted to add that in our tradition, we do try to bury our loved ones quickly, as soon as possible. So the thought of, and if a family does, if they're not aware of the process, they may have some anxiety about, well, what does this mean as far as getting my loved one buried within 24 hours? Will I be able to do the ghusl, which is the washing ritual? So there may be concerns about that. And also, when someone is approaching end of life, what we often will do is have someone in the room reciting from the Quran, the Arabic text. Um, you want family support, around the person, because the idea is that the person, the body, and the person, it's a trust. The body's a trust, and we come around the body and say kind things about our loved one, and we don't say anything negative. So you want it to be a time of dignity, respect, compassion for the person um, who's who's dying. And I think about what Shawn Paul just said about grief. Um, I've always been taught and always heard, like in the psychology world, you never make significant decisions when you're grieving. And we're asking family members to make a significant decision after they've gotten maybe the worst news of their life. And so that's something I think we want to consider. And I think the organ procurement agencies and hospital staff, I think we do a good job, but it's just something to keep in mind, what we're asking and how they're grieving. And it will be different with each family, what, you know, how to see that as part of our compassion. And one other thing is what Dr. Bagby said about removing things that are harmful. So, for example, some Muslim families, well, part of medical ethics, medical bioethics in Islam, Islamic ethics, is we don't do any harm. So there may be people who are thinking, oh, if I go through with this, I'm harming my mother, I'm harming my child. And so there's also this idea of I don't want to do any harm, I can't do any harm. So they may have a frame around organ donation as being harmful and may not approach it as I'm helping someone else and saving another life. So I won't get into the bioethics, but I think there's some factors in there that we could think about as well and how that impacts decisions for the Muslim family.
And that is very important what you were saying, and that was what Dr. Callender mentioned earlier on how we need to start this education and these conversations and take the stigma out on having these conversations earlier on in the communities, in the schools, and being uncomfortable, we don't know to learn also as we try to educate on organ donation, to learn from every community, not only from the Muslim community. And I think I hear all of us mentioning the word compassion, dignity, respect of another human, because at the end of the day, we're all humans. We just want to find the best way authentically and genuinely to be able to serve better. So on that note, Dr. Callender, and I also want to hear if there is anything specific in the National Kidney Foundation from Dr. Purnell. Are there any specific resources that focus on Muslim communities or different communities and the faith of different communities that are being developed by either MOTEP or the National Kidney Foundation or other initiatives? I know you are part of several and many and founders and pioneers of many of them that are specific, something that we as professionals and when we're training people to be family services coordinators, to be requesters for tissue donation, to be that they could have in hand to as a resource, as well as Shampoo calls Karim Ali. All of us have a Karim Ali to call. So, what could be something that we can refer to use to help us understand and work with Muslim families in the best way possible?
Well, I think that's a very important question that you raise. And one of the things that Kareem and I have discussed is the fact that really this is the group that will have to come up with specific uh, public relations and public education documents that are specifically related to uh, clarifying and pointing out how important it is for all religions and ethnic groups to uh, participate in organ and tissue donation. Uh, as far as I'm concerned, there's an inadequate number of education pieces that actually specifically address the Muslim population. And I think this is something that we need to take on as a task because most people believe that there are reasons why they cannot donate rather than recognizing that there aren't reasons why you can't donate. Many of the concerns about death, if the question is not whether you're brain dead or heart dead, the question is whether you're dead or alive. And if you're alive, then you don't take somebody who's sick to make them a donor. On the other hand, if the person is declared dead, either by virtue of heart cessation or by cessation of the brain, because what you mean when you say the brain is dead is that this person is no longer capable of the brain functioning again, which means that the person is dead. And when that occurs, then as actually Dr. Bagby said, then the option is to take them off the machine or not. Uh, uh, and I think that we are not addressing specifically that large population that you mentioned, the Muslim community, adequately. I know that we've addressed specific documents for different ethnic groups, but we haven't done one yet for the Muslim. And I think that's something that you point out that we need to do as soon as possible.
Ingrid, can I add that I want to applaud Kareem's activities in pushing the Fiqh Council of North America, which is this judicial body that issues opinions. I want to applaud him for pushing the Fiqh Council to make their fatwa. But at the end of the discussion, one of the things they said that is needed is an agreed upon set of instructions or guidance that can be given out to families when they are approaching this situation, and a document, a short document that has the approval of, recognized scholars, fiqh councils again, that could, but this has to be a joint effort because obviously people who are scholars in Islam are not necessarily scholars in issues of medicine. And by the way, the Fiqh Council brought in some medical scholars, people who have scholarship in organ donation, and Kareem was there also. But anyway, I think that there is still this need for something that can be passed out to families to give them kind of background and also the Islamic opinion of scholars about some of these issues.
Yeah, I was just going to also echo the importance of the messenger. So again, going back to the issues around distrust and, really what we like to reframe as fear. Much of that is really fear of whether or not I will be led astray, whether it's based upon my spiritual beliefs or my physical health. And often what that requires is trustworthiness, right? And until we as a field, meaning the medical healthcare profession more broadly, reaches that crosshold of really demonstrating that we are worthy of the community's trust, then we must continue to work hand in hand with those who have already earned the trust of such communities. And in saying that, I do honestly, I also point many people right here to this group when asked, well, what are the views and what are the barriers, etc. I'll point right over here because part of what I've also learned is that often there's a danger in also co-opting messages and work that sometimes groups that are already doing the work on the ground have put a lot of effort into, but may not have the highest profile. And then when a topic becomes a hot topic, you see a small select group of individuals who sort of co-opt the narrative of others. And so, in that same spirit of sort of working together to identify these key leaders who are trustworthy and perhaps, bringing our collective strengths together to provide this trustworthy information, but also more importantly, to continue to try and offer platforms for the people who have earned the microphones, I think will also be very important to winning the trust that is not, something that is just owed to us by birthright.
And highlight the work of all of you that have been doing this work and that is kind of behind the scenes, but it's so important. Dr. Zeinab, I'm sorry, go ahead.
Just I want to add, according to your question about the things that we have to consider with when we are with a Muslim family, it's the gender sensitivity and also timing of discussion about these important things, and also cultural and religious resource and communication with sensitivity. I will learn all of these elements in the as a when we want to be a chaplain. It would be great if healthcare team consider these things when they want to talk about these important issues in critical time with the family. And according to my research, I found that the Muslim chaplain, they will be a facilitator between healthcare team and the family, and they could help to make a better decision.
Very quickly, just to add what Zainab is saying, I think it would be beneficial to also have conversations with the Muslim community in the mosques or however we do this about having an advance directive. And while we're having these conversations and talking about advance directives, organ donation could naturally be part of that conversation to give them more knowledge and information before they have to come to a time where they're making a really difficult decision or they don't know what their loved one wants. So I think having advanced directives, and I think we could do a lot better with that, would also be a benefit to help with the donation rate.
I think that's an amazing recommendation. And just to kind of recap a little bit, I wanted to kind of differentiate because all of us are talking, and I think I am understanding that we're talking about also two um, target audiences here when we're developing these guidelines and these resources. One that is going to be for families to understand either brain death better, the position of Islam and their faith and their religion when it comes to organ donation, but also for donation and transplantation professionals, for us to be prepared and trained better when going and getting us set up for success versus for failure. Some of us that have been doing this for several years feel, more and more comfortable when we're working with multicultural families, trying to like overcome all those barriers that I just mentioned, work in partnership, collaboration, identifying the importance of gender or hierarchy when it comes to the elders who needs to be involved in this type of conversations, etc. That comes with experience. However, without being stereotypical or anything like that, because every family is different. There is not a cookie cutter guideline or list that we can develop, but maybe having some fundamentals, some foundation, I think it will also be helpful to develop something like that. I don't know what the panel thinks, but I think that will be also very appreciated in our field if we with a group of experts, of course, and with the collaboration of the Islamic scholars, develop something like this. I think it will be very helpful. I don't know what's your opinion. I open this for everyone.
Yeah, I think one point of influence are the religious leaders, the imams, and also you have a set of scholars also who are not necessarily related to a particular mosque, but training for these religious leaders, I think, is all important because especially at the time of death or serious injury, families would like to at least religiously practicing families, would like to hear some authority, some Islamic authority. So getting them on board, getting them knowledgeable is very important, and that's training that is needed. I must say also that getting some important figures, as in all communities, there are champions, or that's the wrong word, but there are superstars, in the community, right? People who are listened to by the thousands, right? And the American Muslim community has some of those people who have a very large influence. We need to get them on board and to make even just posts that could go out on social media, or little videos or something. I don't know who's going to pay for it. Hey, somebody got some money, but that would go out on the various media platforms that different groups have. So this is a very diverse community. So the Iranians have television shows, the South Asians have television shows, the Arabs have television shows, so, and then there's social media. But anyway, accessing all of those are a way to get the message to the grassroots, and also to perk the ear of the scholars and the religious leaders.
100%. One question comes to mind too, Dr. Callender. Is there any different position as far as living donation and deceased donation for the Muslim community? Are they more prone to donate, to be supportive of living donation, or more against? Or is there any? It just came to my mind, so before I forget, I wanted to ask that.
Well, one of the most important documents I've read in the last 5 to 10 years is the document that Tanjala Purnell wrote that identified that people of virtually all ethnicities, except maybe the Latino Hispanic population, for living donation have just plateaued for the last 20 years. The living donor population has just gone down, down, down. Deceased donation rates have increased, but living donation rates have decreased. And I think this is an opportunity for us to educate and empower the Muslim community as well as other communities. And I think the point that someone mentioned earlier is that educating them before the time of the difficult decision is imperative. And I think I can't overemphasize the point that Bagley made earlier, that when you have people of influence who can actually allow information to be put in print, that will help a lot. And as you mentioned, also have people of influence who, after they come out and speak about it, and then this thing can then be accepted by the scholars and religious leaders in the community, and this can then be put in print. I think this then is probably the next important big step that we need to take, because the earlier the community, whether it's the Muslim community or other community, learns about it, the better. The more public information, education, empowerment that you do before the crisis, when death occurs, the better, and the sooner the better. So that's my take on the matter.
100%. I think we have repeated and repeating, every one of us, how important education. We have identified how important education is there, not only for the families, for the community, for us as professionals, and also for physicians and the people at the hospitals that also need to have an understanding and this knowledge to be able to, because all the work that we do again is a collaboration. we couldn't do the work that we do if we don't have everybody on the same page. So I think that everything that everyone has been adding up through identifying barriers, through identifying challenges, but then kind of shifting the narrative to into what's important, what do we have in common, what do we want to accomplish, which is save lives. We are all humans. We all need to be genuine. We all want to be treated with respect and dignity, to all families. So to kind of close, I want to hear final thoughts from each one of you. We only have like a couple of minutes on really closing this topic, and I think that we have gone through beautifully on how to improve donation authorization rates within this community. Everybody has given advice. Any final thoughts on this topic?
So I think I'll end with I think these were the words of Michael Jackson. I'm starting with the uh, parentheses, woe man in the mirror, right? I think that much of what we are discussing really is a self reflection of ourselves as a field. We have to start with ourselves. We have to earn trust. We have to do better in terms of educating communities. And we have to work to help eliminate barriers for people who want to step up and donate. And I think that once we do that, we will see increases across the board.
I must say that one of the most important points that has been made today by Bagby and others is that there is a lacking of a document that actually says it is okay to be a donor, uh, and this lack of a document that proclaims that is something that we need all together to work on so that we can have that. I know I've talked to him about that for quite a while, and the fatwas and other things, notwithstanding. This to me is the next agenda item that we should make an important one, that we get to the point where we can actually have a document that helps uh, Muslims understand, as well as others, that donating, saving a life is something that is honorable. And to the extent that we can say it's okay, I think that we should, by whatever means. I think that you mentioned people of influence, and that's an important step. But I think in addition, you need to go a step beyond that to get all that to have a document that identifies the appropriateness of us helping other humans.
Absolutely. Chaplain Tahara, final thoughts.
Yeah, just briefly, thank you. Back in 2001, a dear friend decided she's Muslim, she decided she was gonna donate her kidney to um, an African American Christian man that she met at a class. And she said that as he was telling her about his dialysis and what he was going through and how he just hoped to make it a certain amount of time, to live a certain amount of time, she said she thought of the verse from the Quran that if you save one life, is as if you saved all of humanity. And she said in that moment, she just knew. And so I'm mentioning their story because they ended up, she donated her kidney. They ended up starting an organization about organ procurement. And their surgery was scheduled for September 11th, 2001. And it had to be postponed because of the horrific attack. And then it happened later at Cedars-Sinai Hospital in Los Angeles, which is a Jewish hospital, and a Muslim donor and a Christian recipient. So it was a kind of a story in Los Angeles at the time when at our mosque. But I'm saying that to say that, you know, this idea of giving life or giving a chance or giving an opportunity for someone to live, you know, inshallah, as we say, longer is such a beautiful way for us to live out like the Islamic tradition of compassion and to try to do like to serve our community. And this is one way that we don't really think about. I think as Muslims, we don't talk about it. We don't think about this as another way to live out service to humanity. So I would just say that maybe more education around some of the spiritual dynamics, not necessarily religious, legal, but the spiritual, human connection. Hmm? Yes.
Yes, the experience, the story, the journeys. Thank you for sharing that, Sean Paul.
Honestly, I was just sitting here taking it all in, and I couldn't be more proud and feel lucky to be a part of this collaboration. I think that when it comes down to it, from like even the recent experience that I spoke about earlier, um, I think it's very impactful for our communities and these families to know that we're doing things that are fighting for them when they're going through the worst day. Um, Ingrid, you even brought up as far as for being able to make decisions during that sense of acute grief, and I think that it matters so much for us to do things before all of that happens, so that we know that we can honor this family, honor this hero, and save the lives of others, so they can have some type of hope moving forward in their grief journey.
Thank you, Sean Paul. And then I want to give the floor to Dr. Bagby to close us with some final thoughts.
I don't think there are any real obstacles within the Muslim community to really doing a big push on getting the Muslim community to understand the benefits of organ donation. Uh, the Islamic teachings are clear, are so open, and most of the leadership is on board. We need some champions. That's what's missing. The content, the message is there.
I
It's
see
the
many champions.
champions that people. Yeah, we need to, join hands and get the work done. Because I think we could. I'm very optimistic that a lot of progress can be made.
These initiatives give me hope. I'm very, very grateful, and I'm honored to have been part of this conversation. I want to thank you all for being here today and having this really profound conversation in this authentic and genuine manner, because ultimately the mission of us all is to save more lives. So thank you all, and I'll see you next time.